right, it's time to do the heart. So enjoyable. It's not going to take too long. You guys don't really have to know every single cell in the heart, but I want to get more into the assessment piece and the disorders. But let's have a brief review of the cardiovascular system. We know we need the cardiovascular system to help us transport nutrients and oxygen to the body and remove wastes and distribute hormones and antibodies, also to help control our body temperature and maintain electrolytes. Those are the kind of the star functions of the cardiovascular system. We know the heart is a two-sided pump. It's bigger than your fist by a little. It weighs less than a pound. It's located right in the middle of your chest cavity, but a little to the left, right underneath your sternum. That's why when you do compressions, that's where you push. The heart has 4 chambers. There's 2 top chambers and 2 lower chambers. The top chambers are the atria. The lower chambers are the ventricle. And in the body, whenever there's a divide anywhere, like in the nose, they call that the nasal septum, the heart also is divided between the right and left side, and there's a septum there. Sometimes there can be disorders of the septum where it's not fully closed, and blood will kind of shift back and forth when it shouldn't within the heart. So anyway, remember the top chambers of the atria, and that's where blood enters. The lower chambers of the ventricles, and that's where blood leaves the heart, and the septum divides it. We cannot really talk about just the heart and the blood vessels and the body without talking about pulmonary circulation as well. So we have pulmonary circulation that occurs when blood leaves the heart by way of the pulmonary artery, which arteries always take blood away. The pulmonary artery, interestingly enough, is the only vessel in the body where deoxygenated blood exists. All the other arteries have oxygenated blood. And then conversely, the pulmonary vein, and veins always return blood to the heart. So when the blood that's been oxygenated leaves the lungs, it goes exits the lungs and goes into the heart by way of the pulmonary vein. And that's the only vein that has oxygenated blood in it. Anyway, then we have our systemic circulation that occurs when the left side of the heart ejects that blood. The left ventricle wall, it's our extra heavy duty thick to help eject that blood. And hold on, these kids out in the hall are being so loud. All right, there's a lot of background noise in here out in the hallway, but we'll try this again. So anyway, as I said, the blood returns from the body into the right side of the heart. And then also part of circulation is the blood pathways between the digestive organs and the filtering organs, the intestines, the gallbladder, the pancreas, stomach, spleen, and liver, and that's called hepatic circulation. So here's a picture of a normal heart. I want to highlight at the very top the aorta. That's the largest artery in the body, and you'll see those 3 little branches off the top. Those branches feed the brain, so the carotid arteries come off of that. And also the aorta goes all the way down through your chest, down through your abdomen to feed your lower limbs. And you've probably laid on your stomach before and actually felt the pulse. That's the abdominal aorta pulsating. And so if you look on the left-hand side as you're looking at this diagram, I don't know where I left off because I got interrupted again. But anyway, the blood enters the right chamber from the superior and inferior vena cava. And we'll actually trace a drop of blood through the heart, and you'll know it forever. So the heart has really unique tissue. There's the endocardial tissue, which is deep within the heart, within, like an endoscopy where they go up inside of you. That endocardium is a smooth layer of the heart, and it's what the valves are made out of. And you know the valves are, if you know the valves are made out of endocardium, you know the valves are deep inside. Then there's the myocardium. Myo is a prefix that means muscle, and cardium, of course, means heart. So it's the heart muscle. It's the thickest layer. Of course, you got to have thick muscle tissue because that heart never stops beating until the day you die. And then the pericardium, which is this double membrane on the outside of the heart that provides lubrication from the heart and the tissues like of the lungs so they don't stick together because, you know, there's a lot of friction there. So that's kind of a cool little thin layer, double layer around the top. And this is a pretty good picture of the deep, smooth tissue, that rough, ripply myocardium, and then that double membrane pericardium so that it slips and slides and doesn't get stuck on the lungs. So we have some different kind of blood vessels. Arteries, you know, are the biggest blood vessels. The arteries away, it starts with an A, so arteries carry blood away from the heart, and it's the blood is oxygenated, except in that one case of the pulmonary artery. And arteries have a muscular layer that helps pump the blood through the body. And your aorta is the largest artery, and it branches out into smaller ones. And then arterioles are smaller vessels, and they, in arterioles, the blood moves from the arterioles into the smallest layer, which are the capillaries. The capillaries are microscopic valves microscopic vessels that carry blood between the arterial and the venous vessels, and that's where the gas is exchanged, and the blood gives up its oxygen and picks up the carbon. Oh man, I got interrupted again. All right, anyway, veins, they always carry blood back to the heart. They have the blue blood or the deoxygenated blood, except for the pulmonary vein, which brings the freshly oxygenated blood from the lungs back to the heart on the left side, because remember, veins always take blood back to the heart. Veins have a much thinner wall. They don't need the muscle because they don't need to pump the blood through the rest of the body. It's just a return route. The two veins that bring the blood into the heart are the superior vena cava and the inferior vena cava. Those are the largest veins in the body. So let's talk about assessing. You've got to measure blood pressure, and we'll practice that if we have time today. Listening for heart sounds. You can determine the cardiac output. Is the heart being a good pump is basically what that's measuring. Through an EKG, you can measure the muscle activity of the heart or the contractility of the heart. You can take a look with a cardiac catheter, which is inserted. It's a little camera on a wire that's inserted through a nick in the femoral artery, and it travels up to the vessels that feed the heart muscle, and you can see if there's any blocked vessels. And then echocardiogram, which will also give you a reading of the functionality of the heart. So some other assessments, of course, taking the pulse, which is feeling the surge against the walls of the artery. There's 8, sometimes people say 9 pulse points, and I put a little picture off to the side that shows you that. Normal pulse rate for an adult is 60 to 90 beats a minute. Blood pressure, the measure of blood pressure actually is the measurement of the force of blood against the walls of the artery. You have 2 numbers when you're done, like 120/80 is typical for an adult. And the top number is the systolic, or the active contracting phase of the heart. And the bottom number is the diastolic, or the resting phase of the heart cycle. And systolic numbers are always going to be more than diastolic. And the way you measure blood pressure is by listening and feeling, and the systolic is the first sound you hear, and the diastolic is the last on the dial. So you can never have a blood pressure of 80/120. It's always got to be the higher number over the lower number. And blood pressure does vary greatly among people. Most of you guys will have a blood pressure probably of like 100/60. Listening again for the heart sounds, that strong lub-dub sound without any swishes or extra beats to be heard. You can tell that by listening through a stethoscope. If there's an abnormal or extra sound, it could be a murmur, it could be a high-pitched noise, or it could be a really muffly sound. It takes a lot of practice to determine, to diagnose murmurs. And then you'd be followed up with an EKG to see if it's a functional murmur that's not causing any difficulty, or maybe something's really wrong with a valve opening and closing or something like that. Could be an indicator of a disorder. And then there's actually a thrill that you can listen to over an artery and hear the blood kind of whooshing through, and it's an abnormal sound, kind of an extra vibration. So that's another indication we've got a problem. An electrocardiogram gives you a graph of the electrical activity and the contractility of the heart. And echocardiogram is an ultrasonic exam that where you use a transducer and check for the sounds that the ultrasonic waves pick up, and it gives you a graphic design of what kind of contractility is going on in the heart. Cardiac catheterization, again, a little tube is inserted through the femoral artery, and then they can actually release dye, and it can be traced so that you can see if there's any vessels that are blocked. An aneurysm, and that's a little picture of a vessel with a bubble, outpouching. It's an area where the wall of the vessel is weakened. So up here is the aneurysm picture, and this is the aneurysm. So it makes, instead of a nice tight garden hose for the blood to travel through, this is a weakening in the wall, and the blood will kind of collect in a thin-walled little bubble, and that's dangerous because if it ruptures, then you can have a massive bleed, and that would lead to a stroke. This is a picture of atherosclerosis, which causes a narrowing in a blood vessel, and that's by these deposits of fat, calcium, and cholesterol, and it makes for poor blood flow. Also, the cardiac arrhythmias, again, are listened to, and there could be a defect in the heart's pacemaker that causes the electrical activity of the heart. It could be actually damage to the heart muscle, or it could be a valve malformation or dysfunction. Cardiovascular disease is kind of a general term that means the blood vessels are clogged, there's hardening of the arteries, or there's coronary artery disease. Congenital heart disease is a group of disorders that affect a lot of newborns every year, and it could be a number of different defects of the heart too. So there's a disease process with cardiovascular disease and an actual malformation with congenital heart disease. And then congestive heart failure, where the heart just isn't a good pump and the fluid does not get ejected out of the heart, but it backs into the lungs and backs into the right side of the heart, and that's where the congestion is. It's not like a typical congestion that you guys get from a cold, but a congestion in the lungs, and then as a result the body doesn't get what it needs with oxygen, and it's too much of a fluid load for the lungs and the heart. Hypertension is another word for high blood pressure. It's called the silent killer because it can lead to death without any symptoms. A myocardial infarction is known as a heart attack. An infarct is a lack of blood flow to an area. Myocardial, again, myo meaning muscle, cardiac meaning the heart. So the heart muscle has an infarct or lack of blood flow, and that is known as a heart attack. An MI is another term for it, is very painful because there's a lack of blood flow there. So if you've ever had somebody stand on your foot and the blood has not been able to flow, it's very painful. And so that's the same kind of tight pressure that you feel from a heart attack. And then sometimes a clot will form and it'll cause inflammation in the vein because circulation is not good, and that's never good. That phlebitis that you see is something to be watched for, and often ends up the patient gets clot busters and sometimes even an antibiotic. Rheumatic heart disease is another disorder where the heart muscle and the valves get damaged by a recurring bacterial infection like a strep throat or something like that. And varicose veins are a condition where the veins become large and ineffective. When they get all bulgy like that, on the right hand side of that picture you can see there's no blood that's traveling effectively through there, and that's caused from either congenital problems where the walls are weak, or from pressure, standing on your feet for extended periods of time, that type of thing. And this issue, an innovation slide, talks about the heart replacements and transplants. There's actually about 2,300 heart transplants each year in the United States. There's been an artificial heart that people, sorry, let me go back to that slide. Okay, we'll just do it like this. So there's been hearts have been actually been replaced since the late 60s, and there's an artificial heart where there's an external power pump that many people are walking around with that unit still too. And there's some other technologies that I didn't talk about here because they're really pretty innovative. We probably won't see them in this area, but they're all heart replacement type innovations, and that really is kind of key to effective living, is to find that perfect thing that replaces the perfect organ that is the heart. So that's all I want to say about the heart. But we'll learn a little bit more about it after we talk about the workbook too.